Okay, I'm setting things up, my friends. Don't worry. I'm setting things up. I'm setting things up as we want to talk about issues of the stomach. Issues of the stomach. If someone is not getting me right, please tell me, tell me, tell me, tell me, tell me, tell me. Sometimes when I'm using this app, the sound is very down. So don't be like if you feel you're not getting me straight, good. When I'm using this app, you raise the voice of your device. If you are using a phone, raise the phone's you raise the voice of your device, because sometimes the sound is so low and some people complain that you cannot hear the voice. So I'm just doing some setup here so that I can, when someone asks a question and this person wants a picture, I can show it and advise well, not hear the voice. So I'm just doing some. Now we go on. Today we are talking about issues of the stomach. Issues of the stomach. You know, when it comes to the stomach is the central fueling part of the body. The stomach is the central fueling part of the body. We are we are at let me see. Now, if you have questions at times, just ask. If you have questions at times, just ask, because you may have a question and you really want to know uh, what is going on with your body. Maybe the topics that we are discussing, they are facing you. The topics that we are discussing are facing you, and you don't know. They might be. So asking a question always helps you to do what? To be at par of what you're doing. So what are gastrointestinal issues? Before we get to gastrointestinal issues, we should know, what are we dealing with? Are we dealing with the brain? Yeah? Gastrointestinal issues. A minute. Where we do here. We should talk about the gastric system. Rogers Killer, greetings from Kisii town. Welcome to the chat, my bro. Welcome to the chat. Today we are talking about issues about the stomach. Yeah? We are talking about issues about the stomach. So I'm finding a picture of the gastric system picture to put it so that, yes, the stomach picture. Picture. So people who have problems with the stomach, today we want to discuss and know how we can help you, because sometimes we may be, you may be having a problem and someone is telling you you have a problem with the gastric system, your stomach, and you see the symptoms that you have are not really the gastric system. The symptoms that you have are not of the stomach. So let me find a picture here to share. How are you, bro? It's raining here that I can't hear you, but watching. Yes, Rogers, increase the device volume. Increase the device volume. Volume, please. Please increase the device volume, please. We want to check out several things about the gastric issues. The stomach. When I'm talking about the gastric issues, I'm talking about the stomach. The stomach is a very funny place. It is the power bank. It is the power bank of your body. And I want to put a picture there of the stomach. Okay. No image. I want to put an image of your stomach so that when I'm talking, people are where is this picture? No, perhaps yes. Let me see, where is this picture? I'm trying to find a picture so that we can relate. Yes, I found it. We can be relating as we talk. We relate on this picture, the picture that is coming in your system, in your the picture that is coming in your platform. Today we will talk about the powerhouse of your yes, look at that. Look at what is coming on your platform. Look at what is coming on your platform. You see that? That is called the powerhouse of your yes. That I'm trying to put this picture so that you can learn with it. On my screen, you can see there is a picture of okay, of someone who wants me to tell him that I'm online. So I will tell him so that he doesn't lose our. Jamaican uncle really wants us to he really wants to be online when I'm online. Let me call him so that he can be here, because when we start we don't have so many questions about what we are dealing with. So I'm calling him now. What is the gastrointestinal system? Yeah. Yes, uncle, I'm online. Please share the link. Yes. Oh, okay. Well, yes. That is one of our good friends, one of our really good friends. You see, when you have friends that support you, your mental health becomes stable. But when you have friends is this that yes, hello, yes, hi, niko poa. Naongea na nani? Yes, just be faster. I'm lecturing now online. Yes, niambie. Mm. Yes. Okay, come pass by. Ukifika ambia msichana niambie. Okay. That is sometimes you may be online, and you see that is the problem when you are a doctor. You do things that uh, you do things and some things counter you. You do these things and then some things counter you, and we are used to that. So please don't feel bad when I'm being called online. uh, Please understand that this person is a doctor and he needs some people needs welcome Jamaican uncle, welcome uncle at Jamaican uncle. So setting things up takes a lot of issues. Like, so I'm online, I want to start a topic, and then someone is calling me. This person needs help. What do? You just talk to this person. Now let's continue on issues of the gastric region. Gastrointestinal issues are problems that affect the digestive system, yes, which include organs that help digest food, absorb nutrients, and remove waste. These organs include, just imagine, look at that picture that is out there. The picture that you are seeing. You see that picture that you are seeing? Those are organs of the gastrointestinal system. When you have up the Mutua's wall is in the building. If you are not listening or getting me right, please you tell me that the, the Mutua's wall. Welcome. So when you understand about the gastrointestinal system, how do we know that this is a problem that includes the gastrointestinal system? Here we have said gastrointestinal system are problems that affect the digestive system, which include organs that help digest food, the stomach, the small intestine, and the big intestines, the colon, and remove waste, the organ that removes waste. These organs include, look at the platform, that organ. It includes what? The mouth. The mouth is here where I'm pointing. The pharynx is here below the mouth. You see, I think you can read well. The pharynx, and then we go down. The esophagus, the pipe here. You see I'm pointing. The esophagus down here is where the food goes down, but the pharynx is above. It has its work. And then we go down to the stomach, and then we go down to the small intestines, the large intestine, and the rectum. You get it? And then we go down to now I'm just introducing. We have not started. So the problem that is in your stomach, the problem that is in your stomach starts from the mouth. The problem that is in your stomach, just as we have said, gastrointestinal system include the mouth, the pharynx, the esophagus, the stomach, the pancreas. So when you have a problem, you in your stomach feeling bloated, feeling what, it means that you are having a problem throughout these things. This, you see what I've named there, you are having a problem there. So we can go so fast to get to know these problems before we start discussing them one by one. And if you have a question, as I always say, please don't. Boss one is in the house. Welcome, the Mutua's world. Welcome to the channel. We applaud your presence. Jamaican uncle, Roger Killer, all of them that are here, we love you, and we continue helping each other. Well, now today we are talking about issues of the stomach. And we have said the issues of the stomach don't just start from your stomach, they start from your mouth. And we have said clearly and explained this way: the stomach is the powerhouse. When you are eating, you are adding fuel to your. So gastric issues are problems that affect the digestive system, which includes organs that helps to digest food, absorb food, and remove the waste from there, because you cannot stay with food for long. You have to get the nutrients, and then the food goes away. So there are these things that are very important in your body. The mouth, because you have to eat. The esophagus, the food you have to go down if the power. The stomach itself, the small intestine, the large intestine, the liver, the pancreas and the gallbladder. These are organs of the stomach issues. Yes, the stomach issue. Now, these are some of the issues that you may be having when you have the stomach issues, and we will discuss. I've just named, and you see the picture that is there. It is discussing how food flows up to the rectum. The rectum is down there. So we will say this common gastrointestinal issues. Today we are not talking about mental health, because even mental health can affect your intestinal issues. Today we are talking about the stomach. Now, indigestion. People that have indigestion. What is indigestion? Indigestion is when you eat food, digestion that doesn't happen. The food doesn't flow around your body. So what happens? Bloating happens. You feel nausea because that food have to go away from your body. Please, as we talk, let's ask the questions. If you have an issue that is not private, let's interact. And always remember, the Mutua's World is in the house. Jamaican uncle, if you are viewing this video, please follow them. Go and like their videos and check. Someone to help put their links here for those like Rogers Killia. All those links, I need them here. Please put them, the links here, as people are going through. They will look at your content, and then you do what? You feel nice. So what we do is this, Dorothy. Okay, so what we do is this. What we do is this. We continue with the topic, but Dorothy, examine and then tell me the problem. I'll tell you treatment. Now, okay, we continue. Indigestion. We call it in medical terms dyspepsia. When food is not being digested, you always eat food, but food is not going through your alimentary canal. So it takes so long to do what? It takes so long to be digested. What do you get? You get bloating, nausea, early fullness, burning sensation in your stomach, and then you don't go to the loo every time. You don't go for long calls every time. That one is a problem called indigestion. Causes. And what are the causes? Overeating, fatty or spicy food, stress. You see, mental health still comes in. Gastric or peptic ulcers disease. Now, the second problem that you can have when it comes to issues of the stomach, we have started with indigestion. The second one is GERD. We call it gastroesophageal reflux disease. The people that have heartburns always. People that have heartburns, even when you are treated, you are always having heartburns. Soreness in your mouth, you get it? Soreness in your mouth. Your mouth is having soreness every time. GERD. We will talk about these problems one by one, and we will know how to treat these problems one by one. So we continue with the GERD. GERD is gastroesophageal reflux disease. Reflux is it is refluxing. It wants to come out, and then you feel acidity. That one is a problem. The second one, we have another problem called peptic ulcer disease. Those people who always say that they have ulcerations. Yes. Those people who say they have ulcerations. You get it? That is a very bad problem, and we will talk about ulcerations, and we will know how to treat ulceration. So if you are here and you are always having ulceration, we will see how to make things happen to you. And then we have another one which is called constipation. What is constipation? Constipation, because some people just say at times we are suffering from constipation. When you're talking about constipation, what are you talking about? Infrequent bowel movement. You are eating food, but it's not getting along. You are always having dehydration, lack of physical activities can cause. And constipation mostly is displayed by one. What? It's displayed by hard stool that even sometimes cannot pass. Eh? Straining, abdominal discomfort. There is another one called diarrhea, my friend. That is the fifth problem that we will discuss, the diarrhea. You are always having a diarrhea. We are talking today about the stomach issues. Diarrhea, frequent loose or watery stool that is not stopping in your stomach. Bacterial infection, viral infections can cause your stomach to have a problem. Food poisoning, antibiotics. Imagine you are taking antibiotics and then you are having problems in your stomach. Sometimes overuse of antibiotics is bad because you will be having a diarrhea caused by antibiotics. If you are a lady, you know Candida albicans, the white discharge in your private parts comes in because of using antibiotics. We will see how these things relate and how these things. Today is the introduction of the gastrointestinal issues. And then there is something called people that never get well. People that never get well when it comes to they never get well when it comes to having acidity, always having pain. Hmm? You see, it is called irritable bowel syndrome. Irritable bowel syndrome. Abdominal pain, you are always bloating, having constipation or diarrhea, and excess gas. We will talk about it again. IBS. You go to a hospital and then the doctor looks at you, examines you, and then he writes irritable bowel syndrome. We will see what irritable bowel syndrome. If you have any of this, please talk here. We see inflammatory bowel disease. There are some diseases that are called inflammatory bowel disease, like the Crohn's disease, ulcerative colitis. Crohn's disease and ulcerative colitis are two different things. You will see Crohn's, you have problems from patches of ulcers from your pharynx up to the rectum. And then there is ulcerative. We will learn and know the difference between the Crohn's disease and ulcerative bowel disease. So if this topic is a long topic, it's not like the herbal complementary medicine. This is another topic that will go for another 1 month or two. So I'm just introducing the topics that we will be going through the month. Warning signs of serious GI disease. There are some warning signs that you can get, that like blood stool, severe abdominal pain, severe persistent vomiting, unexplained weight loss, difficulties swallowing. You get it. And then common causes are infections in the abdomen. In the abdomen, when you're having a problem, you always know the common causes are poor diet. You have high fiber, you are high fat. You like eating high fat food but low fibers. You don't like eating vegetables. You get it? You don't like eating vegetables. It's a problem, and you will give yourself irritable bowel disease after some time. We have the other one, which is called the infections. Infections are so many. Infections are so many, and infections comes in turn of several protozoas. Yeah? In Africa, we have our tropical protozoas that disturb. I've just seen a friend of mine in the rice field, and I've told her to be careful about something called schistosomiasis. It's a bad vector, schistosomiasis, and it brings so very bad diseases, and we cannot allow to do what? To even take care of it. Infections, stress, and then we have alcohol, smoking, we have medication, food intolerance, lactose intolerance. That there are some people who cannot take milk because milk has lactose. And you know, when you take milk, what happens? It brings several problems in your body. Brings several problems in your body. You get it? So this is just the introduction of the problems that we are going to talk about this from today. And then we have general things, you know, bad habits like food that you eat. So let me remind ourselves what we will be talking about. I'm just introducing, and if you have a topic about you want to we talk about something that you have in your stomach, please let me know. Let me go and bring a picture of some issues so that as we talk it's in the background. Just a minute, give me a minute, I come back. Hi. Sorry, guys. There is something that I wanted to get, but I've not got it. Yeah, we continue with our topic. We continue with our topic now. Our topic is talking about the gastrointestinal issues. The gastrointestinal issues of the stomach. I see Beth Bubbly is here. A bubbly girl is in the house. Now, let's review the issues that we are talking about. At least 10 issues before we go to the deepest ones. We got gastroesophageal reflux diseases, gut, peptic ulcer diseases, we will talk about it. And then we have gastritis, inflammation of the stomach lining. You are going to a doctor and then you are told that you have gastritis. We want to know what gastritis is and what gastritis can do to you. You see, I know many people here have been told you have gastritis. What can bring gastritis? That is the third one. Constipation. People that have hard stool, you get it? People that have hard stool and they don't like eating fiber, they eat good food, they call them good food like pizzas, fatty food, you will get gastritis. And then we go to diarrhea. What can cause diarrhea? These are issues that we are starting today to discuss. What can cause diarrhea? And then we have another one called irritable bowel syndrome. Irritable bowel syndrome, my friend, you feel pain every time. Every time you go to hospitals, You are being given antibiotics, and then you are given relaxers, and your stomach still comes up. That one, it's called IBS. We will know what irritable bowel syndrome is. I'm introducing the topic, please. I'm introducing the topic. Let's talk of the inflammatory bowel disease. Inflammatory bowel disease. Anyone in this here that you know inflammatory bowel disease? If I'm talking something that you've been diagnosed through previously, let's talk about it, because the stomach has so many issues, and we have said when we are talking about the gastric issues, we are talking about the stomach issues, and these stomach issues, they start from the mouth cavity, pharynx, esophagus, stomach, pancreas, intestines, gallbladder, large intestine, rectum, and the liver. You get it? Even the liver is part of your, you know, people think this, it is very funny. When you are bloated, is your stomach that is having gas. As we learn, you will be surprised that your stomach can be so good, but you are having problems in your abdomen. Eh? There is a difference between the stomach and the abdomen, because the abdomen carries a lot of organs, like what you are seeing in the in that picture that I've put there. That picture has a stomach, a pancreas, a small intestine, big intestine, large rectum, and the liver and the gallbladder. Those are part of the abdomen, but there is a stomach. So the general term that people use when it comes to problems with the gastrointestinal system is what? I have problems with my stomach. You see, don't have problems with your stomach. Let's learn what is the problem. Yeah, we have inflammatory bowel diseases. Inflammatory bowel diseases. What are inflammatory bowel diseases? What are inflammatory bowel diseases? There are two. When I'm talking about inflammatory, let's think of inflammation. Inflammation. Let's talk of inflammation. Inflammation is redness, warmth. You remember about our topic on inflammation. So there are only two diseases when it comes to inflammatory bowel diseases, and these diseases are Crohn's disease. These diseases are Crohn's disease, and there is another one called ulcerative colitis. Ulcerative, I see Mercy Grace, Bubbly, Jamaican Uncle, Boss One in the house, the boss himself in the house, Rogers Killian. And today, guys, you don't want to drop your links. Please drop your link so that someone can follow you if you have a channel. Someone might be here and you have a channel, and this person doesn't know you have a channel. So please be open, drop. So true, Mercy is teaching us over here. Yeah, drop your channel there. Please drop your channel so that we can follow you and see your good. Like today, I've seen a channel of Mercy, or who? In a not it's Mercy or someone in a rice field. It was an authentic serenity, good view, and I liked it, and I said one day I'm gonna visit the rice field. But it comes with a topic called schistosomiasis, the problems that we get when we go to rice fields. We will talk about it very soon. Now, inflammatory bowel diseases are two: Crohn's disease and ulcerative colitis. Crohn's disease and ulcerative colitis. But we have another one called appendicitis. Anyone in this platform that you've had appendicitis and you are okay to tell us, please raise your hand. Raise your hand if you once had appendicitis. Appendicitis, please raise your hand. Or if you've ever had appendicitis, raise your hand. It is a very bad situation. Appendicitis, it is a very bad situation. We will talk about it. The appendix. People say that it is the part of your body that doesn't have work. Like, let me tell you, no part of your body doesn't have work. We will see what the appendix does to your body. We will see what the appendix does to your body. And then we have the other one called gallstones. Gallstones. What are gallstones? These are hard deposits in gallbladder. You see, we have in the stomach, there are so many things. In the stomach, there are so many things. Cholelithiasis. When you hear about, in medicine, anything you hear about chole, chole, let me paste that thing there. Chole. Just know this thing is talking about fats. Chole. I'm posting it in the chat. Chol means fats. Chol means fat. So this is a problem of gallstones, and you get it. And then we have hemorrhoids. Hemorrhoids, you know hemorrhoids. Please tell me if you please tell me if you know hemorrhoids. Distended blood vessels down there and the anus region. Can you explain it, please? Monsieur, thanks for being Jamaican uncle. What do you want me to explain, please? Ah, yes, Mercy Grace. Yes, yes, Mercy Grace. And people are not putting here their channels. Please put your channel here. If a person comes here and he has not subscribed to you, let's follow you. Rogers Boswan, gentlemen. You can post it yourself. Post it yourself. Give this live a like. Yes, yes, yes. Thanks a lot. Give it a like. Yes, I know it. Uncle is asking to explain. I want to know, Jamaican uncle, what do you want me to explain? Tell me. Now, we continue here. Hemorrhoids, swollen veins in the rectum or anus. You see, those are hemorrhoids, and we will talk about hemorrhoids. And then we have lactose intolerance. People with lactose intolerance. What does not that mean? It means inability to digest lactose, milk, sugar. Milk and sugar. You cannot digest them, and we will know how you cannot. Admin to put the links, please. Admin. I don't have an admin. You, if you have your link and you want people to follow you, please put it there. Now we have lactose intolerance and celiac disease, which is autoimmune reaction to gluten that damages your small intestine. This is called celiac disease. Please go ahead because they say that you will later. Now, you see, when you eat gluten, foods like that have gluten, wheat and so-called foods, and then you have a problem with your stomach causing damages on the intestine. What does that mean? It means you have celiac disease. We will talk about celiac disease. And if I'm talking about something and you have it, please don't be shy. Let's help you. Someone can be here and he has a way. This person is experienced on how to go about this problem, because this person has been in and out of hospital and now he has found a solution that I don't know. We can discuss it. So don't be always shy when it comes to discussing issues concerning a problem when it is medical, unless it is so private and it may affect you mentally. So let's go on. There are some issues that we have to discuss. When I'm talking about fecal oral, I'm talking about what you eat and what goes out. You get it? The foods that are the problems that come because of sanitation. Problems that come because of sanitation. These ones we have to discuss them, and I think they will be the best ones to start with, because sanitation is the key element of life when it comes to the stomach issues, the abdomen issues. Sanitation. We will start with cholera. Cholera that is brought by a very funny bacteria called Vibrio cholerae. Very bad bacteria that makes you diarrhea every time. You close your eyes, you want to sleep, you are running to the stomach. You wake up in the morning, the first thing you are dehydrated, running to the stomach, to the loo, and then you end up in hospital being rehydrated. That is cholera. Cholera, we will talk about it. It really affects so many people in Africa, and it kills. And then we talk about the second one, which is so common. Every person who has a stomach issue and this person goes to a hospital, the first thing they want to do is that one. Please, I know you are listening. Even you, one of you, have been told you have that one. That thing that is called typhoid. Typhoid, my friend. Typhoid is a very funny thing. Typhoid is a very funny thing. Yeah? You go to a hospital, you are let's take you to a laboratory, your blood comes, you give blood, you give your sample of the mutuas. Typhoid is very common. Eh? Uh, you see, typhoid is very common. What is happening? Yes, it has come. Typhoid is very common. Typhoid is not a good thing. Typhoid is not a good thing. Let me attest. But you know, something funny is people that are diagnosed with typhoid, it is not really typhoid. We will explain why. You can be always be testing typhoid positive and you are not having the typhoid. Let that time come, you will know why you are being given drugs that are not helping you, and every time you are going to the hospital, you are being taken a sample. What happens? You are being told you have typhoid. Just imagine, very bad, very bad. Shigellosis is another one. Shigella, cause is Shigella. Shigellosis. When you eat food, bad food that has this bacteria, my friend, you may think it is decent. Shigellosis. My friend, diarrhea comes in and out. Shigella is not a good bacteria. You should not always eat bad food. We will talk about Shigella. And then there is another common person here, not person. There is a very common parasite, a very common thing, a friend to typhoid. That every time a person goes to hospital, I live in Kenya, and I understand so many diagnoses of this thing comes out. Even if you go to a pharmacy somewhere, you want over-the-counter medicine, they tell you, oh, that is this. Just guess it. Amoeba. Yes. I can see the mutuas have been in and out. Amoeba. Hey, this is not a good thing because amoeba can cause something called amoebiasis, and it may kill your liver. Amoeba is a bad thing and it may kill your liver. Amoeba may destroy your liver. We will talk about amoeba and the causes of problems with amoeba and how to counteract amoeba. But you know, amoeba is being brought by Entamoeba histolytica. That is the cause Entamoeba histolytica. What brings the disease itself is called amoebiasis. And we have another disease called amoebiatic liver disease. So there is amoebiasis for the stomach, and we have amoebiatic liver disease. If you stay with amoeba for so long, we will know what can happen. And then we have gardiasis. Now, gardiasis is a sister to amoeba, this is gardiasis is a sister to amoeba and typhoid. But we will see there are different parasites. There are different parasites that bring these diseases. Someone has asked me previously, can you be immunized against this? We will know one day if it is immunizable as we read through. Now, those people that have jaundice, yellowish of the eye, fever, and then always in and out of hospital. With jaundice, I said, it is the problem of liver cells destruction. So how does it come along? It comes along with hepatitis. Hepatitis is, I said, hep. Hep is the liver. Hep. A word we use in medicine called the liver. It is called hep. Titis is problem, inflammation. So hepatitis is the liver problem. So we say hepatitis A is a problem because it is when you eat, it is spread through your food. Hepatitis A. Thank you so much for the loves, please. Thank you so much for the loves. Share the content, and please don't forget to share your link here. Share your link here so that we can have more of people following you. We are a family. Share your link there. If don't worry, I don't have an admin here for now. You just share your link. Now we go to another one called rota infection. When those people that have children, they go to immunize their children against rotavirus. So rota is a virus that can destroy you right, left, and center. It brings dehydration, vomiting, severe diarrhea, and severe diarrhea. You get it? So there is these viral infections that we will talk about, and these viral infections are rotavirus. Another one is the other one is norovirus, and then we have a parasite called ascariasis, enterobius. All those we will talk about them. Now, when you're talking about common problems of the stomach, I've said today I'm just introducing. As I'm about to finish introduction, please. I'm about to finish introduction. So if you have a question and you are here, please put your question here. If your stomach has been having a problem for long, shoot your question. I'll know how to answer it. If it is private, my email address, always let me put it there. Everyone has my email address. benjaokwesh@yahoo.com. You get it? benjaokwesh@yahoo.com. That is my email address. If it is a private thing that you feel Dr. Ben can advise you, you can use that email address to reach me, and I will always respond. So any question about what we will be doing this week, if you have any question that is random, please just ask. Do you have any question that is random that you really need me to help you about? Please ask. Now, before I finish, let me go through very fast the topics that we will talk about. The topics that we will go about: gastrointestinal reflux disease. We will talk about peptic ulcer disease. We will talk about gastritis. We will talk about constipation. We will talk about diarrhea. Anyone with a question, please ask as we finish. We will talk about diseases that can give you diarrhea, irritable bowel syndrome, inflammatory bowel disease, inflammation of the stomach, Crohn's and ulcerative colitis. We will talk about them. Appendicitis, the appendix, gallstones, hemorrhoids, lactose intolerance, celiac disease, and then we will go to those diseases that are spread through poor sanitation. People that don't know how to take sanitation at par. This can bring you these diseases: cholera, typhoid. We had talked about typhoid at a place. We will talk about shigellosis, amoebiasis, and amoeba. We will talk about amoeba in your stomach and amoeba in your liver. Amoeba can stay in your liver and it can damage you so bad. So we will talk about that, and then we have giardiasis, that is a sister of amoeba and typhoid. And then we have the hepatitis A and E. We will see if you eat bad foods that are contaminated, the virus that you can get and you start having problems are A and E. We will talk about rota infection. We will talk about norovirus. We will talk about enterobius. These are the problems that you can give yourself when you are eating dirty food. Now, I see today people are so quiet and they are listening keenly. Those are the topics that we will discuss. I have sent it to because okay. Now you see, those are the topics we will discuss this week and this month. This is a very long topic, and it's just today. At least today I found some time to come here and discuss this topic of the stomach. You see, so we will know how to so anyone who has I'm giving a chance to anyone who has one day talk about gastritis and how to prevent it. Yes, it is in the I've named it Mercy Grace. I've named it Mercy Grace. It is in the topics that are coming, gastritis. And what is gastritis? Gastritis is acidity that is always coming and not going. Hmm? Gastritis is acidity. That topic is in the is one of this week. It is we will talk about gastritis, inflammation of the stomach, gastric mucosa, and you have always acidity. It may occur suddenly or develop over time. You see, it is the inflammation. We will talk about it. It is a very long topic, and several things can bring gastritis. You get it? Now I still have 2 minutes. Now 2 minutes. Mercy has said, or if you want, we start with gastritis. We will start with it. But I wanted we start with topics that we start with the topics of sanitation. Your stomach having problems because of sanitation. Your stomach having problems because of sanitation. That I think that is the way we can go. And then if like Mercy Grace wants us to talk about gastritis, I may start with it. But as we start with it, the day of gastritis, we will do images. We will do images. So anyone who has a topic that she thinks that we can start with, please bring it up. If you think this is a nice topic that you've been suffering from, because we are here to deal with the when we are here online, we are here to deal with the topic that disturb people mostly, and they can be treated. And as you noted, the mutuas have named two: typhoid and amoeba. Those are the ones that we will start with as we go on. And then we go to gastritis. We can do random topics as we go on because it may be helping someone as we go. Any other question? Any other question? Now I'm waiting for questions. Anyone who has a question, please. Before I log off, please ask a question. Even if it is from the previous topic, please ask. Even if you've gone through a video and you thought you want to know about something, please ask. Please ask. Anyone who has a question, please ask. I'm waiting before I go. I at least I think I'll find some time always to be here at 4:30 Kenyan time. 4:30 Kenyan time. But if I want to be here at 4:30, you know the time that I can be here is 7. Not 7, 10 or 9:30 Kenyan time. 9 Kenyan time. So I think today we don't have so many questions. Yes, doctor, thank you for finding time to get us. Yes, thanks, Mercy Grace. So I think today the time is up, and we'll meet you tomorrow as we start our topic. I'll start with either typhoid, amoeba, or gastritis. Have a lovely day. Let's